Hello, I'm Dr. Lawrence Brown, the Director of the County Health Rankings and Roadmaps program. We are proud to present this special webinar series on the way that communities are responding to COVID-19. Throughout this series, we will lift up the social and economic dimensions of the current pandemic. In addition, we aim to highlight the historical context of place and space to help explain where and why COVID-19 hotspots are emerging. Finally, we will provide a forum for the stories of impacted communities and their innovative solutions that we hope you will share and lift up. We also know that before the pandemic arrived and now, not everyone has had the same opportunity to live a long and healthy life. Story after story in the news media shows the disproportionate impact of COVID-19 in Black, Latino, and tribal communities. This pandemic is shining a light on long-standing inequities that exist in this country because of racism, historical trauma, urban apartheid, and rural disinvestment at every level, designed to create barriers to opportunity that we must overcome. We intend for this webinar series to be an opportunity for community leaders to come together, examine the inequities this pandemic has exacerbated, and explore data and evidence-informed strategies that can enable positive change both during the time of crisis and during the time of recovery and healing. We encourage you to share what's working in your community and learn from others who are also making tremendous strides. Let us work together to build a new nation on the foundation of health equity and social solidarity.
Welcome to COVID-19, Disproportionate Impact on Black Communities. This webinar is the second in our Health Equity and Social Solidarity in the Time of Pandemic, Strategies for COVID-19 Response and Recovery series. County Health Rankings and Roadmaps is based at the University of Wisconsin Population Health Institute and is a collaboration with the Robert Wood Johnson Foundation. We would also like to acknowledge that this webinar series is a result of the contributions of many colleagues and partners in Wisconsin and across the nation. Thanks to their support, we're able to bring you this webinar today. Before we go any further, I'd like to ask you to join me in a moment of silence for lives lost to COVID-19 and to police violence. My name is Attica Scott, and I am an action learning coach at County Health Rankings and Roadmaps. Today, I'm joined by my colleague, Ali Havrilla, who is also an action learning coach with our organization. Hey, Ali.
Hi, Attica. Welcome, everyone. Glad to spend some time with you this afternoon.
Thanks, Ali. I also want to take a moment to introduce other colleagues joining us to enhance your learning experience. Raquel Bornanesque will be chatting with you in the chat box. Hey, Raquel.
Everyone, so glad to be here today.
Thanks, Raquel. And our technologist, James Lloyd, will take care of any technology issues that you have. Hey, James.
Hi, everybody. Glad to be here for this webinar. And if you have any questions, you can find me in the chat and send me a direct message, and I can help work out any technology issues you're having. Thanks
so much, James. I also want to invite you to join us after the webinar to dig deeper into today's topic along with our guest. Immediately following the webinar, we will offer an interactive discussion group to exchange thoughts about how strategies related to today's topic may work in your communities. These conversations give you the chance to really be face-to-face virtually with other webinar attendees and to share what you are doing locally, as well as ask questions of other participants. We are pleased to be able to offer these sessions in partnership with Healthy Places by Design, and Joanne Lee with Healthy Places by Design will be our lead facilitator of the discussion group. So watch the chat for details about how to connect later in the webinar. Raquel is so good. She'll be sending information as we approach the closing of the webinar. She'll probably send it out 2 or 3 times so that you can be sure to grab that webinar link. So now I want to introduce you to our honored guests. Ms. Cassandra Welchland is the lead organizer and co-convener of the Mississippi Black Women's Roundtable and co-founder of the Mississippi Women's Economic Security Initiative. Hey, Cassandra.
Hi, everybody.
Cassandra, we look forward to hearing from you, and we'll see you again in just a moment.
Thank you.
Delegate Janelle Wilkins is a member of the Maryland House of Delegates, representing Montgomery County, Maryland, and is Director of State and Local Government Affairs at the Leadership Conference on Civil and Human Rights. Welcome, Delegate Wilkins.
Thank you so much. Hi, everyone.
And we will see Delegate Wilkins again in just a moment. Dr. Kamara Jones is a family physician and epidemiologist, a senior fellow and associate professor at Morehouse School of Medicine, and past president of the American Public Health Association. Hello, Dr. Jones, welcome.
Hi, everybody. Really, really happy to be here.
Thank you, Dr. Jones, and we'll see Dr. Jones again in just a moment. County Health Rankings and Roadmaps has 2 overarching goals. The first is to improve health outcomes for all. This includes both how long people live and how healthy they are. The second goal is to close health gaps between those with the most and the least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we were born into. But not everyone has the same opportunity to make healthy choices. These unequal opportunities create differences in health, and they don't come about on their own or because of the actions of individuals alone. They are often the result of policies and practices at every level that have created deep-rooted barriers to good health for some people. We see this in areas like bank lending practices, redlining, and school funding based largely on local property taxes. That means that everyone does not have a fair and just opportunity to live a long and healthy life. Our goal is to help change that by offering communities data, evidence, and guidance to take action. I'm Southern, so you'll hear me say data and you'll hear me say data, just so you know. I'm talking about the same thing. Be sure to stay in touch with us because we share information out with you about our data, evidence, guidance, and stories on our Facebook and our Twitter. And Raquel will be sending out links to follow us on those social media platforms as well throughout the webinar. So I just want to talk a little bit more about the data, evidence, guidance, and stories, because that's where I live as an action learning coach. That's where Allie and Raquel both live as action learning coaches as well. So with the data, most of you probably are aware of your county health snapshot that we provide on the website. We have health measures that we provide in your snapshot, and we also have reports that we produce periodically. Through our evidence, we have what works for health strategies. Oh my goodness, y'all, this database of evidence-informed policies and practices is a go-to for me, and I encourage you to bookmark it on your website so that you can go there often and see examples of policies and programs in other places that really are about building a culture of health. And then with guidance, we have our Action Center, key activities for taking action. And we also have our Partner Center as you're thinking about who to partnership to really build a culture of health. And then our stories are the way that we really lift up the communities that are digging in deep to build that culture of health, to address some of the issues that you on this webinar are probably interested in. So I encourage you to go visit the stories on our website as well. And I know Raquel is chatting out links for you to be able to navigate there quickly. So I do want to lift up for you that one of the ways that we start with our work is through our model. So I imagine many of you are familiar with our model. We know that the rankings really are a starting point for your work. We use the rankings to broaden conversations about health and equity, to draw attention to gaps by place and race, to prompt urgency on the issues that influence health, and to move conversations to action. And so as we think about COVID-19, what we provide at County Health Rankings and Roadmaps is data that can complement your local or your state COVID data in terms of thinking about areas and populations that are at most risk, which we're going to be talking about today, and to help inform your response and how public health departments and their partners could focus on assisting with moving forward and thinking about how to equitably distribute resources to all people in order to continue to improve health for everyone. So I just wanted to lift up our model as something that you might want to check out on our website as a resource. But now I want to get back to our guests. So I'm going to welcome back Delegate Wilkins, Dr. Jones, and Cassandra Welchland so that we can dig into our conversation with these three fabulous, amazing individuals. So we're going to be talking about the disproportionate impact of COVID-19 on Black folks. So it's going to be a pretty heavy conversation. So what I'd like to start out with is just asking each of you, what's bringing you joy right now? And I'll start with Cassandra in Mississippi and just ask, what's bringing you joy right now?
Well, two things is bringing me joy. Right now, I'm just a block up from my state capitol, and they're in there debating about whether to change the flag. And it seems as if they have enough votes in order to bring that flag down. And so that's bringing me a lot of joy, as we know that banner has been a terrorist banner for Black folks in Mississippi. And so I'm excited about that. The other thing is bringing me joy is my children. They are going through a lot, as I'm sure so many of you all can imagine, have your own children. And we've been giving our kids joy parties. They've been seeing a lot, hearing a lot. My son just last week said, "Mama," because he saw Rayshard Brooks get murdered, and he said, "Mama, are they about to kill Black people again?" And that was really hard. And so we said, we're going to give you a joy party because everyone deserves joy. So we got a big water slide in our backyard that took up half the water slide. We made a joy table with bubbles, all of their favorite things, and we just had a joy party. And that has been really incredible. And those are the things that's bringing me joy.
That's beautiful. Thank you. A joy party. I may have to adopt that one. Thank
Yes.
you. Dr. Jones, what's bringing you joy right now?
So I'll say two things too. The first thing is that I'm working hard, and you might say working hard is bringing you joy, but it's like all of a sudden the work that I've been doing for decades about naming, measuring, and addressing the impacts of racism on the health and well-being of the nation, all of a sudden people are very interested in learning more about this work. And so I am just like, as all of us, I'm sure all of us are, but I am so happy that right now people are willing to name racism and they're interested in learning more. And I do not intend to let people fall back into what I'm describing as the sleepiness or the somnolence of racism denial. So the fact that I'm working hard is actually bringing me joy because it's like, finally you're understanding what we have been talking about for centuries and what I've been working on for decades. The other thing is that I'm back home. I was for 9 months, I was in a small apartment in Massachusetts. And when COVID-19 happened, I actually hid out in my apartment. I had the luxury to do that. For 10.5 weeks, I didn't even go outside at all. Now I'm at home in Atlanta, and at least I feel safe to walk up and down the street, so I'm getting some sunshine.
Beautiful. Sunshine is joyous. Thank you.
Yeah.
What about you, Delegate Wilkins? What's bringing you joy right now?
Well, the responses from these two definitely have brought a lot of joy. So thank you for that. And I think for me, it's also the plus side of what's happening in our country is that I feel a increase in the collective consciousness around disparities, around what's been happening around police violence. And not only that, but changes starting to occur, whether it's state and local legislation that's passing, companies that are making changes, people who've never been involved who are now outspoken and calling for change. And so I am really inspired and excited and feel joyful about just the collective action that a lot of people are taking, and just wanting to continue that work to make sure that we see long-term changes.
Beautiful. Y'all just helped me to feel better. Thank you so much. So I want to get right into the conversation, and I'll start with you, Dr. Jones. So I'd like to hear from you about some of the root causes of the disproportionate impact of COVID-19 on Black folks, and really intrigued and interested in the definition of racism that you use, that I think might be helpful for some of the folks who are tuning in to the webinar. So if you could share that with us, I'd appreciate it.
Yes, well, thank you for asking, Annika. So I'm going to first start with why COVID-19 was a wake-up call, right? Because we have had racial disparities in health and in education and incarceration, and lots of racial disparities, and people haven't been awakened to, like, oh my God, racism, right? They've just gotten used to it. So what happened with COVID-19 is that here was a virus. No human on this planet was immune to this at the end of November, beginning of December, not one. And if opportunity were equally distributed, at least in this country or across the world, but if opportunity were equally distributed, if exposure to risk were even equally distributed, there would be no way that you could slice and dice the population and find any kind of group differences in terms of who was getting infected and who was dying. So that was the expectation. And then all of a sudden, we're seeing that Black folks and then Indigenous folks and then Latinx folks and Pacific Islanders are being more infected and then dying more. And so that, and the Black and the Indigenous and the brown bodies were piling up so fast and so unexpectedly that people couldn't normalize it or ignore it. So that is the reason that racism, people started acknowledging that COVID-19 just kind of pulled the sheet off of US racism and exposed the cracks and the structural horrors of our nation. But I'll say even those cracks have been pulled off before with, Hurricane Katrina. Like, why couldn't the Black people get out? Why is it the Black folks stuck in their houses or on the roofs or drowning in their attics? It happened when the Flint water supply was poisoned, right? And why did that happen to a Black city? And why was it only 5 Black cities in Michigan who had emergency managers? So people have awakened each time, right? And then they've fallen back into this slumber of denial. So let me define racism. Racism is the system that does structure opportunity and assign value based on the social interpretation of how one looks, which is what we call race in this country. So it is a system, first of all, not an individual character flaw, not a personal moral failing, not a psychiatric illness, although it can manifest in all of those ways. But it's a system of power that does 2 things. It structures opportunity and assigns value based on what? On so-called race. And it has 3 impacts. The first impact, most people could say, it unfairly disadvantages some individuals and communities. The second impact, people might be scratching their heads. They can't figure that out. But every unfair disadvantage has its reciprocal unfair advantage. So racism is also unfairly advantaging other individuals and communities. That's the whole issue of unearned white privilege that we hardly ever talk about in this country, because it makes some people, especially some people who are living as white, uncomfortable, right? So I used to say, shake it off if you feel uncomfortable. I'll tell you some stories, right? Let's get through this. I don't say shake it off anymore. I say if you feel uncomfortable, you need to lean into that discomfort, because for each of us, the edge of our comfort is our growing edge. The third impact, so now we got to, yes, it's unfairly disadvantaging some, unfairly advantaging others. Racism is sapping the strength of the whole society through the waste of human resources. And what we need to know very briefly is that, yes, it is important for us to assert that Black lives matter. But it's not just that Black lives matter. Black lives are precious. Black lives are genius. Black lives are leaders. Black lives are generous and loving and, everything, creative. And when we shorten Black lives, either by not investing in their full education or by the disproportionate incarceration of Black and brown people, when we shorten Black lives with vigilante killings or police killings, that's not just something that happens to the person or the family or the community. That is sapping the strength of the whole society through the waste of human resources. I'm going to stop talking now because I want to get into the details of how it does with COVID, but not right now because I've talked too long.
Oh, no, thank you so much, Dr. Jones. You really helped, I believe, to set the foundation of this conversation. And so, Delegate Wilkins, I think this is actually a natural place for you to build on what Dr. Jones has shared about racism and how COVID-19 has impacted us, because you've been doing some amazing work in Maryland around housing during COVID-19. I mean, you know, nationally, folks are looking at you for the work that you've been doing. So can you talk about what home means in the midst of a global pandemic, and especially in the context of racial equity and structural racism?
Absolutely. Home has really taken on a new meaning, I think, for all of us. And I think it's really deepened for us what it means to have a safe place to stay. Our governments have said to us, stay at home. Home is safety. Home is security. Home is health. Home is, if you're lucky enough to be able to work from home, home is how you are making a living right now for a lot of people who are able to do so. And so I think that one of the things we have to look at when we're looking at how precious home has been for so many is that home is also the biggest expense for most people that they spend on every single month. And for Black people and Latinos in particular, and low-income individuals, as a result of structural racism, they tend to spend more per month on their housing when you look at the percentage than most people. And that comes from a history of lending, of redlining, and lots of housing discriminatory laws that have been structured in this way. And so you compound that with then having people who are low wage, who tend to be on the front lines, who are having to go out to make their living. And you add that to overcrowding and living spaces that are less than ideal. You're seeing these clusters all over the country, and I can say so in my community, when we finally released zip code data that we had to fight to get, that when you looked at the zip code and the most diverse zip codes, you really dug in and you really know your community and who lives there, it was very easy to see that it is those low-wage workers, immigrants, Black people, Latinos, who are most severely impacted when it comes to COVID-19. So you put into place what I just mentioned around home being so important, around affordability issues, around who's being impacted by COVID-19. And then on top of that, we have a situation where so many people are losing their income. And although many states and jurisdictions have put into place these eviction moratoriums, unfortunately, that's not going to be enough for people to stay in the homes that we have told them is so important for safety and for their health. And so that's part of where we are right now. July 1st is around the corner, which is whether you have a mortgage or you're paying rent. It's probably going to be one of the hardest days yet in terms of being able to afford that. So I think that that's a critical part of the conversation as we think about the disparities and how much more particular communities are impacted around housing, and that compounded with the virus and infection rates as well.
All right, Delegate Wilkins, thank you so much for breaking that down and really opening up the door to Cassandra, because I think this is a way for you, Cassandra, to really talk about in Mississippi, how are you having conversations with folks about race, right? How are you having those constructive conversations in community and with organizations and with institutions? And, you know, in the backdrop, you're at the state capitol, right? And there's something major happening today with the flag. Like, how are you having these conversations about race?
Well, one of the things that we always do is that we have to be, and I'm always very honest about anything that we do, particularly in the South, you must have a racial justice lens to it. It needs to happen in the country, but particularly in the South and in Mississippi, where we saw, you know, the stronghold of racism last so much longer than anywhere else, right, in the country. And so we never can do policy making, never can have any of these kinds of conversations around structural change, structural racism, policy change, without talking about racism and having that lens there, because it informs, as Dr. Jones says, it informs the policymaking process. And we know that policymaking process really impacts what happens at people's kitchen tables, right? How much money they get, as Delegate Wilkins said, what their health care looks like, it happens at that state capitol. And so, but another thing that's important in this is that we don't like to have that conversation without talking about a gender lens too. Because we know in Mississippi who was impacted the most. And we know that Black folks, Black women are impacted at a much higher rate in this state. And so we're having those kinds of conversations, you know, with our women right now. As we have developed our policy platforms, we talk to women about like, what is it that you need in order to take care of your families? And we heard several things, and we keep hearing these things. Childcare was number one. We heard that they needed access to health care. We hear, and that's health care also in their pregnancy, postpartum, right? That's really important. We heard, you know, domestic violence and sexual assault, stronger protections around those things. And, you know, a living wage, wages is so important. And so it has exacerbated now that COVID is here. And one of the things that we have been hearing from like childcare providers whose businesses are being impacted so significantly, but we know that childcare centers are the community centers of our community, right? Because they are taking care of our children. But when those centers close down, then there's a whole gap that exists. And so we've been having conversations with our women who are the Black-owned business owners and who are also the single mamas out there who job let them off, but we have a governor that wants to get people back on, back employed because they know that the unemployment insurance is the highest that they've ever made, $600, $700 a week. And they want to tell them, go back to work if your employer calls you. And we know that the history in Mississippi is to roll people off of these, what they call welfare rolls, so they can say, oh, we have really set a model here of how to get people employed and sustainable, you know, on their jobs. But that's not the case. The case is race-based. Let's be real clear about that, right? And so, and saying, you know, to these folks, you know, COVID is not under control. Mississippi had some of the highest rates on Wednesday, and it was just significant. And so we can't say, go back to work when you know that the rates are high. And then we know that Black folks and Black women particularly are, you know, they are, you know, in the workforce at a really high rate, and they're making these low wage wages. And so they can't take care of their families. And so we're hearing them say, no, we can't take care of our families on this $7.25, right? And I don't feel safe going back into that workplace knowing that the numbers are up. And my families, my mama, my sister, they're dying, you know? And so these are the kinds of things that we are addressing, and we are saying, and we're elevating their voices and their issues and concerns. And so, so we weave race and we weave a gender analysis into all of this because we know that Black women in Mississippi, in the South, are being impacted the most, but yet we are the ones that's the economic drivers and the backbones of Mississippi's economy.
All right. Look, Dr. Jones is like, I have something to say in response. Go ahead, Dr. Jones.
I have a question for you, Cassandra. So this is something, so I am perplexed why everybody is trying to get people back to work so much, whereas in Denmark and Germany and UK, New Zealand, what they do is they have something like a universal basic income so that people can stay safe health-wise and still pay their bills and still do this stuff. And I heard, but I don't know if it's true, so this is a quick question for you, but that your mayor was considering in Jackson, Mississippi, a universal basic income. So I would like to know, yes, no, maybe so, and like, how is that going?
Yes, he is considering it. I don't know any more than that, but there is a consideration to do that. And there is another organization here in Mississippi that's actually exploring a cash-based, a universal cash model as well. And so, yes, he is exploring that. And I've heard others are also thinking about it as well.
And I heard that it's happening in Stockton, California.
California, yes.
Yeah.
So you know, like this is something that can happen. It's happening in other places. But instead of trying to protect the health of people, you know, the governors and all this, they're pretending that they're trying to help the people because, you know, the people who lost the most jobs or the biggest impact is on low-wage workers, you know, the Black people. First of all, it doesn't just so happen that low-wage workers, you know, that Black folks are overrepresented in that. So like we have to examine that. And then they were bragging about, oh, well, you know, before this, the unemployment rate for Blacks was the lowest it had been for a while. But in these jobs, right, which is no future type of thing. And I wonder, do they think that about how in 1862, the unemployment rate for Black folks in this country was 0, but did that mean that we had the best situation we had, employment-wise or health-wise or not? So we have to be, all of these arguments that are coming about, oh, it's for your benefit that we're getting back to work, and yet they're trying to protect employers, that if you can't, the employer can't be sued.
Right.
You know, if somebody gets sick or dies. Like, this is very much essential workers in the same way that enslaved people were essential workers to the profit of other people, but it's not essential and protected or essential and cherished or, you know, none of that. And it's not essential and paid. It's not essential and paid sick leave. It's not essential and Family and Medical Leave Act. It's not essential and hazard pay. It's not essential and nothing but essential and disposable.
Yes.
Wow. So you both are moving us toward this conversation around a just recovery that I want to get to with Delegate Wilkins. But before I do, Delegate Wilkins, thank you so much, Cassandra, for lifting up the ways in which y'all are having conversations in Mississippi. I wanted to first ask Dr. Jones, just to kind of build off of what's happening in Mississippi. What are you hearing about what communities are doing to truly address racism? Like, what are cities, counties, states doing to address racism?
Well, so they're starting to talk about it, number one. So starting last May, before COVID-19, before the highly viewed killing of George Floyd and Ahmaud Arbery and Breonna Taylor before that, and Rayshard Brooks after. Before this, in May of 2019, Milwaukee County in Wisconsin was the first county that I'm aware of that declared racism to be a public health crisis. And then we go to April of the next year, April 2020, who was the first group to release data stratified by race and ethnicity in terms of COVID-19 infections and deaths? It was Milwaukee. No accident, because they already were thinking racism is a public health crisis. And then this COVID-19 comes through and they were like, we better look because we know racism is going on here. And they were the first ones. Since then, I am aware of 2 states, 21 counties, and 23 cities across this nation that have declared racism to either be a public health crisis or a public health emergency. I think that's important. It's just talk at this level for some of them. They just did it last week, right? But it's a stake in the sand. They are now saying you can hold us accountable. We have made a public statement that we recognize racism. And then the question is going to be, what are they going to do afterward? But I am encouraged because when I was president of APHA and launched us on a national campaign against racism, there were 3 tasks. The first was to name racism, say the whole word. That's what these groups are doing. The second is then to figure out, how is racism operating here? What are the levers that we can move on? And the third is to organize and strategize to act. So these jurisdictions have at least taken step 1.
Thank you. And I know that Raquel is sending out a link for folks in the chat where they can go and see what cities and counties and states have indeed passed these statements. Delegate Wilkins, a just recovery. Can you talk to us about what it means, what it looks like to move toward a just recovery, and especially thinking short-term and long-term, right? Because some folks want to see something happen as immediately as possible, but we also know there's some long-term work that has to happen.
Absolutely. I think that building off of what Dr. Jones was talking about earlier and what I mentioned as what is bringing me joy, I think that we have to reimagine what is possible. Some of the issues that have been dead on arrival, like universal basic income in certain communities, are now issues that are truly at the table. One of my colleagues, Delegate Acevero, has introduced a UBI bill into the Maryland General Assembly for the last 2 years. And, you know, when he's introduced that, people have looked at him like, what are you talking about? This is something that absolutely is just out of the realm of possibility. But we're seeing members of Congress having serious conversations about UBI, Jackson, Mississippi, and jurisdictions in places all over the country where things like that are on the table. So I think first and foremost, we have to really reimagine and think big about the society that we want to rebuild. and not go back to, you know, where we were before. So I think that that's first and foremost. In terms of some of the immediate actions, we have to be data driven. And first of all, we need to have the data. In Maryland, we're uncovering more and more. We have the race and ethnicity and zip code, but we're also seeing that counties are reporting different things, and we need to have some universal standards of reporting throughout our state and throughout the country to really dig into and understand what is taking place when it comes to this racial disparity. And then from there, some of the immediate actions that we need to take, they needs to be driven by what the data is telling us. So for us in Maryland, some of the things that we have seen from the data that we have so far is that one, there's a major concern, and the Legislative Black Caucus of Maryland will be pushing on this a lot more in the coming weeks, is that as Maryland is moving into the different phases, what we're seeing is that we're moving ahead and we're opening up, and it's being purported that, okay, we're seeing less hospitalizations and we're seeing less deaths. But when you look at the data disaggregated by race and ethnicity, you're seeing a different story. So when we're talking about recovering and opening up, it really needs to be driven by those vulnerable communities who are disproportionately impacted rather than in the aggregate. So that is something that is just absolutely critical, because again, as we've discussed, these communities are seeing more deaths, are seeing more cases of the virus, and are just disproportionately impacted in a whole lot of different ways. We're also seeing that the testing sites are actually not matching up with where the communities who need them the most and where they are located in terms of where we are seeing the most cases and the most deaths. So there's a mismatch there, at least in Maryland. So when it comes to some of the immediate steps, when we're looking at recovery, when we're looking at moving into phases, when we are looking at ensuring that we're really mitigating this virus, those are two things that we're really looking at. In addition to that, we have to continue the work in terms of having leadership, in terms of having targeted resources that are focused in on the racial disparity. That means having a disparity commission that is not just talking, not just, you know, sharing information and putting out data, but truly empowered to act, to target resources, and to really identify and implement solutions related to the disparity. I'd like to see that in every state across the country. And I know some states have started to do that as well. Also, as we think about the long term, I would lift up all of the issues that we've talked about here. Housing. We've seen the virus expose the cracks in our systems, the things that a lot of us have known and have been really raising the flag around for a long time, but we're really seeing it come out in a different way and being amplified because of this virus. So in the long term, not going back to where we are, but now reimagining how we house people, this safety, health, affordability, our health disparities, of course, access to health insurance, where we've seen, you know, people who, especially at the beginning of this crisis, weren't even able to get care or get tested, and some still aren't able to, depending on how jurisdictions have acted in terms of being able to increase access. Income inequality issues, and I actually had universal basic income on my list here, Dr. Jones, so I'm glad that you raised that. And then also the policing issues, our criminal justice system, all of that is really at play and critical as we think about and reimagine our society and what a recovery looks like.
All right. Thank you, Delegate Wilkins. I feel like you've just given people their agenda for how they move forward once they leave this webinar. So I want to open it up to the audience questions. I know Allie's been monitoring the Q&A, and I just want to say to folks who are tuning in that this conversation will continue in the discussion group, and our capacity for the discussion group is 300 people, so just want to make sure you're aware of that, but we will be sharing the recordings out with you of this webinar, so we just wanted to make sure that you were aware of that. And there were some topics that I know, Dr. Jones, you wanted to touch on around racism denial. You talked about that some, but that may come up in one of the questions. And I know we wanted to challenge the audience to think about what they can do when they leave this webinar. But before we get at least to those challenges, Allie, I want to go ahead and check in with you to see what's coming through in the Q&A questions for our guests.
Yeah, great. Thanks, Attica. We have had a lot of great questions come in, and I think one that we might lift up is, what are some of the strategies, both immediate and perhaps long-term, maybe we could adhere one of each, to help move forward and make sure that we don't revert back into sort of the state of emergency. So how do we lean into this moment of unveiling of health disparities and take action, like I said, both now and maybe a long-term strategy as well?
May I go first on that?
Sure.
Okay. So I don't have the actual strategies. I have the principles. And the principles, you can apply those whatever kind of work you're doing or whatever. So there are 3 principles for achieving social justice or achieving health equity, however you want to articulate it, that I would like to put forward. And if you want your work to be about social justice or health equity, you need to be doing at least one of these, but I would say all 3. The first is valuing all individuals and populations equally. And when you value people equally, you involve them in decision making, you protect them, and you invest in them. Just think of the word value. You could generate off the top of your head 10 things that value means. Well, you need to do that for all individuals and populations equally. The second is recognizing and rectifying historical injustices, right? So that means we need to know history. We act in this country as if the present, we're disconnected from the past, and as if the current distribution of advantage and disadvantage were just a happenstance. So first of all, we need to learn our full histories, and then we need to rectify those histories. That's about reparations. That's about investment, massive investment in communities and the like. And so after valuing all individuals and populations equally, recognizing and rectifying historical injustices, the third principle for achieving health equity is providing resources according to need. Not equally, but according to need. And that requires 2 things. It requires the very hard work of establishing a metric of need that everybody agrees to, but maybe that's infant mortality rates. Maybe it's maternal mortality rates, some metric of need. But then even harder, it would seem then that once you establish the metric of need, then we could just provide resources according to that. But the political will to provide resources according to need has to be tremendous, because the default is if you're a state health officer with 5 counties and you get $1 million, each of those counties wants their $200,000. And you need to have the political will to say, no, County A, you're not getting any this year, or maybe not next year or the year next after that, because you don't need it, and County E needs this money. So anyway.
And just real quick, there was a request. Could you repeat the third principle that you lifted up?
Yes. So the first is valuing all individuals and populations equally. The second is recognizing and rectifying historical injustices. The third is providing resources according to need.
That Cassandra or Delegate Wilkins, would you like to lift up any strategies?
So I agree with everything Dr. Jones just said. I would just add that leadership matters. And I can't have this conversation without talking about voting. And so people must, this election cycle, we must turn out the vote. And we also have got to put pressure on our elected officials, in particular, I'm seeing a lot in red states, to really let people get access to the polls during this pandemic. And so that's, online voting, mail-in voting, but we have got to push voting access. Right now, we know in this country, particularly in the South again, where disenfranchisement has happened, the voter suppression has occurred. And so we must do those things. And we gotta elect leaders that really speak to the principles that Dr. Jones just laid out. I don't even have to go through that. We got to speak to those principles. I'll also say, and the millennial vote is so critical and key right now. And so doing everything that we can to give them the tools that they need in order to help turn out the vote. So voting is important. I'm gonna add this piece to this, if I can just speak truth to power just one more time. White women, if you really believe that where we are, that racial injustice has to, that we're in a critical moment, we need you to vote the right way. And I want to be real honest about that. We need you to vote the right way. 2016 was you didn't stand with Black women. And so we're saying to you, stand with Black women. And that means your vote needs to represent that.
And Delegate Wilkins, I'll let you chime in.
I'll be brief since I shared a little bit about the long term and the short term, but I would sum all of it up in saying that we need to move from awareness to action. And that's what I have been really trying to push in our state, because we've had these numbers for months, weeks now in terms of the racial disparity. We've seen it, and there has been a lack of action on it. And so I think that for all of us on this call, and for those who aren't able to join us, I think our call to action is really just moving from that awareness phase where we're hearing and we're seeing that there is this disparity into action items to address it and save lives right now, and also those long-term policy solutions that we've been discussing.
Thanks.
May I ask, Allie, may I ask a question of both Ms. Welch-Lin and Delegate Wilkins?
Real quick, and then I'll let Attica take the mic back over to wrap us up.
Okay, I want to ask about, I have found that there are young people who I've been consulting with, you know, in like public health support for the protests, the mobilizations and stuff. And then I was saying that one of our messages should be to vote, like the after action messages. And they were like, oh no, we don't believe that we need to vote. You know, we're out in the streets. I know so-and-so who did this whole thing on her own and it's really effective in the community. And I couldn't believe it, because my idea was that when you stand in a protest or a mobilization, you are standing to say, look at me, here I am, count me in this mass. And I think it's the same process when you vote. It's like, here I am, count me. So how do we break through this millennial, especially even among our folks, you know, the activists right now who are getting people in the streets who might not be ready to vote? I just would love anything that you guys know to do about that.
I think we do have to make the connection for people, especially as an elected official. It's really important to me that we help folks to understand that we do need the right people in these seats who are championing the issues that they care about. So we can't even begin to have this conversation around the policies that we've discussed. We've talked about everything from housing to health access to universal basic income and so many things in between. We can't even begin to have those issues move or pass if we don't have the people in the seats who are introducing, championing, and working to pass these types of bills. So I think we have to connect the issues that they care about and the fact that we just have to have the foundation is having the right people in the seats. There's still organizing and advocacy that has to happen to realize these solutions. So I'm always very careful not to say just vote, but we also need you to stay engaged. We need you to make sure your elected officials are hearing from you, know that you're paying attention, they know what your priorities are, and so on and so forth. So I like to say vote and find other ways to engage as well. But I think it's important for people to understand that voting and getting the right people in the office is foundational to this type of work that we're talking about.
And I would just add, what we're hearing here, you know, in Mississippi is that voting is important and it's critical from the young people. I think the thing that has to happen is really making sure there is this intergenerational bridge that's happening. And you know, in the South and Mississippi, we are known for that, the intergenerational, you know, model. And so the accountability has to be there, where our elders are also speaking to our young people about the importance of doing this collectively, and also doing the connectivity that Delegate Wilkins said. So that intergenerational model is so key and important, and really having these trusted relationships where these elders can go in and say, let me pull your coattail, you know, little girl, which I've gotten a couple times. So that's really important.
Thank you all so much. Allie, thanks for lifting up those questions. Folks, I want y'all to know that Allie is continuing to monitor the Q&A, and some of those questions will follow over into the discussion group. Thank you so much to our guests. I just want to wrap us up so that we can get to the discussion group. Raquel is chatting a link to a very brief webinar evaluation, because we really do appreciate your feedback, and we use your feedback to make changes for the next webinar. So I would invite you to join us throughout the summer for additional webinars in our series. Speaking of universal basic income, last month's series included a conversation about universal basic income and the Stockton model. So that's available in our archives on our website. We will be continuing to highlight the challenges communities are facing as they respond to COVID-19. Each webinar will be followed by a discussion group opportunity just like this one. And in the discussion groups, you will get to learn from and connect with researchers, policymakers, and each other. I'd like to give a shout out for our July 9th special topics webinar in this series that will be facilitated by our own Carla Freeman, who is one of our amazing action learning coaches. And that webinar will focus on COVID-19 and its disproportionate impact on the Navajo Nation and tribal communities. So join us for that and all of our other webinars, and please make sure to mark your calendars for these opportunities. Raquel is chatting out the link for you. So we have our discussion group that's scheduled immediately when this webinar closes. Again, Joanne Lee with Healthy Places by Design will be the main facilitator, but you will see some of our staff co-facilitating with her. And Raquel is going to chat out a link to that discussion group. And just for some teasers, I was going to ask our guests to lift these up, but I'll go ahead and just share them with you. I know Dr. Jones is going to be talking about the 7 barriers to health equity. I know Cassandra is going to be talking about how do we center these 2 pandemics that have been lifted up during this conversation on Black women. And Delegate Wilkins is going to be talking about how do you work with local and state elected officials. So thank you all so much for tuning in. Thank you so much to our guests. I appreciate you tremendously. And please join us over in the discussion group. And we'll leave this window open for a few minutes so that you can get the links to the discussion group. Thank you all so much. Take care.